Hello ma'am.
Hello.
So today our topic is microwave ablation. So a lot of women ask this question about microwave ablation and everything. So I just want to ask you first to introduce. So what is microwave ablation?
Yeah, so microwave ablation is a procedure. We do this to treat a condition called as adenomyosis. Adenomyosis of the uterus is treated by this. So microwave is a high energy, it's a heat. So we use heat to ablate or shrink the tissues of the uterus so that adenomyosis where the tissues are grown beyond their capacity, beyond their size, are again shrunk back because of the heat generated from a rod. That is called as microwave ablation.
Who should get this procedure?
Yes, so this adenomyosis is a painful condition. So usually surgery is advised, and previously the surgery was removing that adenomyome part where it is affected or removing the whole uterus. So now this is a non-surgical option where by a minimum invasion we can do this procedure. So this we can do to young women who still have not finished their family, who want to retain their youth. So for young women, I mean age from 20 to 35 or 40, who have not yet planned their pregnancy or who have finished their family but are at a very young age, they can undergo this procedure.
So how is this procedure done, ma'am?
Yes, so this is done either an ultrasound guidance or a laparoscopic guidance. So basically laparoscopic guidance is more preferable. The woman is admitted, you given anesthesia, and by laparoscopy, so small cuts are made in the skin and a laparoscope goes into your stomach, and then that rod like thing through which we can pass on that high energy is passed into the uterus, and looking at the ultrasound. So we look at the ultrasound as to how much area we are ablating, how much we need to shrink, burn or ablate those tissues, and then we decide on how much minute that energy has to go. So the frequency, the strength, the power of energy, the duration of energy, and the diameter is decided based on the how much adenomyosis you have. So that is decided by the doctor, and the energy is given at 2 to 3 sites on the uterus, and the tissue shrinkage happens.
So ma'am, is microwave ablation safe to women who plan to get pregnant?
Yes, definitely yes, because in this procedure we are not giving any cut on the uterus. So once you give a cut, the uterus weakens. So in this procedure we are only passing a rod or a small needle-like structure into the uterus, and it is the shrinkage is happening. So it is definitely safe for women who are planning to get pregnant.
So can they become pregnant after the procedure, ma'am?
Yes. So by doing this procedure we are restoring the anatomy. So once the uterus is enlarged a lot, the relationship to the fallopian tube, all the anatomy is distorted. So by doing this procedure we are shrinking it back to its normal, trying to bring back to normal size. So the anatomy is restored, then definitely her pregnancy chances increase. They can become pregnant. If not normally, at least by an IVF procedure or another assisted reproductive techniques, the pregnancy can happen.
So ma'am, will the patient need to stay in the hospital or it is a daycare, ma'am?
So this can be done in a daycare procedure, but it is preferable you stay in the hospital for a day, and then because of anesthesia and a small laparoscopy procedure, it is better to stay for a day and then go home next day.
So ma'am, are there any risks in this procedure?
Yes, so this is a very safe, minimally invasive procedure, but remember it is an heat, lot of energy. So the doctor should be experienced in doing this procedure. It's not just putting a needle. We have to calculate how much energy should go for how much duration and how much tissues we want to shrink. So it has to be a very planned procedure.
So ma'am, will the patient need pain medicines after the procedure?
Yeah, so usually 90% of the time the pain goes away because of the shrinkage of the tissues, but sometimes maybe a small amount. So if the girl has been using 8 to 10 painkillers during one period, her pain medicines might go down to just 1 tablet or maybe no tablet at all. Pain relief is excellent.
So ma'am, is the procedure costly, ma'am?
No, it is not. It is covered under insurance, and it should be the same as any other laparoscopic surgery.